31 here in New York now. We have all of our folks trying to track down and trace down what's going on the back and forth. First, on Saturday, President Obama said in Grand Junction, Colorado, the public option may or may not have to be an integral part of health care reform. And then yesterday, you had Kathleen Sebelius on the Sunday program saying something similar. Her comments were quickly pulled back, and now we're trying to figure out where is the White House position this morning when it comes to health care reform and a public government-run option. Is it in or is it out? Also writing an op-ed piece in the Sunday Times, the president making his case for why Americans need health care reform. But House Republican leaders say many of the president's claims are simply rhetoric with no basis in reality. I'm going to put that now to Republican Congresswoman Marsha Blackburn of Tennessee down there in Nashville. And good morning to you and welcome back here. I just want to read to you what he said on Saturday. The president says the public option, whether we have it or we don't have it, is not the entirety of health care reform. He continues, so we are working on a series of proposals to address the questions that you're raising. That was a question that was posed by a 23-year-old college student in Grand Junction, Colorado. I mean, take us between the lines right now. Is this compromise in the White House? Are they taking it off the table in order to get a bill done?
Yeah, you know, it's interesting to hear where they're going on this, and I've got the copy that they put out of their bill, the summary of their bill that came out July 19th. And you know what is so interesting here, Bill? Page 116 to 118, section 221, they are mandated to create a public option in this bill. You know, it actually says establishment and administration of a public health insurance option as an exchange-qualified health benefits plan. So that is a mandate that is in the bill.
Put that in English for me.
It means you have to have a government-run public option plan that is going to compete with private plans.
Oh, so it may be, the reality might be that they're backpedaling on all this just to try and save the bill. You've got a mid-September deadline coming up that Senator Conrad told Chris Wallace over the weekend that we're not bound by any deadline, so it looks like possibly a second deadline may come and go. I mentioned the New York Times op-ed article. I know you came on today to refute some of the claims that were made by President Obama. He made 4 or 5 statements, basically, and the second one was this: reform will finally bring skyrocketing health care costs under control. Now, you've come on TV to tell us that in your own home state of Tennessee that simply was not the case. What is the example you found in the volunteer state?
What we saw in Tennessee with the TennCare plan, which was the test case for public option health plan put in place in 1994, it was to be a $2.5 billion program. It ended up being over $8 billion about 5 years later, consumed about 36% of the state budget. And it has been a very difficult plan. There's been a lot of work in trying to bring that plan back under control. But even the CBO, in scoring the coverage, just the coverage components of H.R. 3200, they're looking at $239 billion additional to the deficit, to the debt.
So you're saying the point is, in Tennessee, the costs went up and nobody expected them to, or nobody at least publicly said that they would, and they did. Is that what your case is?
That's right. The cost quadrupled. And what you're looking at now is a bill that has scored at over $1 trillion for coverage. And that is according to the CBO. So if you say, well, they're looking at it being over $1 trillion, it probably would end up being closer to $3 or $4 trillion.
Based on your example
if you look at the Tennessee, that's right.
Now, the president would say, and he said this in the New York Times on Sunday, in the coming weeks, the cynics and the naysayers will continue to exploit fear and concerns for political gain. They'd say you're a cynic. What do you say?
I say that I'm looking at past experience, and there are lots of lessons learned from the TennCare example and how that played out in our state. We should be mindful of those, and we should also be listening to CBO when they tell us what it is going to add to the annual deficit, what it is going to add to our accrued debt. We are looking at debt that is going to be upwards of upwards of $13 trillion. And I think those are very dangerous numbers. And what we are doing is capping the futures of our children. And it is of tremendous concern to me.
Well, in the 15 seconds or so I have left here, try and climb this mountain for us. How does the White House save a health care reform bill?
I think they need to just take out a clean sheet of paper, start over, and say, let's look at what everybody agrees on. Health insurance costs too much. We need to look at restricted access. We need some health insurance market reforms. And for goodness sakes, let's have liability and tort reform.
Marsha
Let's get
Blackburn,
the costs down.
Thank you, and I appreciate you allowing me to
Bill.
interrupt you for the last 6 minutes, too. Thank you. We got a lot to get through, and we did. Thank you.